Any girl who's suffering severe pain with their periods, pain that keeps them in bed, pain that stops them doing normal things, this is not normal.
Endometriosis is a condition that can affect anyone who menstruates, so while that's primarily girls and women, it can also affect non-binary people and trans men. It's primarily caused by the backward flow of menstrual tissue, so instead of coming out via the vagina during your menstrual period, it flows backwards through the fallopian tubes and into the peritoneal cavity. That tissue can attach itself onto peritoneal organs, including the bladder and the bowel, or the outside of the uterus, and can form lesions which can cause chronic pain.
Conditions like endometriosis are not very well known, despite the fact it's just as common as something like diabetes.
The diagnostic delay is anywhere between 6 to 12 years.
The disease progresses, and if it progresses for 7 to 10 years before a proper diagnosis, it is much more difficult to treat.
Up until very recently, the only way to diagnose endometriosis was an invasive laparoscopy. People with endo, they have to take analgesics, or they're typically put on hormones to sort of cease the growth of those lesions in the peritoneal cavity, but they don't get rid of the lesions themselves. So an actual treatment that can attack and clear those lesions, or even stop them from developing, would be the holy grail. Endometriosis is a chronic inflammatory disease. We're looking to see whether we can harness your immune system to work with you instead of against you.
We've decided to look at menstrual fluid as a potential way of diagnosing this disease and also for personalised medicine.